Hello, fellow Texans, and welcome to Surviving the 21st with Sarah Bowman. As you can see, I'm doing my show from my home today. In fact, I'm reading this script off of a shelf from my freezer. It's surprisingly easy to DIY a teleprompter. MSNBC published a news report on April 17th, 2020, criticizing Trump for his call to liberate some states. Texas will be one of the first states to reopen on April 22nd, although it has one of the highest rates of confirmed cases in the U.S. Personally, I find it interesting that the MSNBC reporter failed to mention the lawsuit activists and pastors filed against the Texas governor, Greg Abbott. Abbott is trying to represent what he thinks his people want, which is the responsibility of a governor. Media bias has developed exponentially in recent years, and it's easy to see why Trump is perceived as biased. In May of 2019, PBS published Trump's Trade War, which talks about Trump putting tariffs on Chinese goods in an effort to promote domestically produced goods. Unfortunately, this nationalist attitude has only gotten worse and more prevalent during this global pandemic, as Trump not only repeatedly called COVID-19 the Chinese virus, yet blamed the World Health Organization for not sharing Chinese data sooner. While doing research for this video, it's scary to realize China's government was in fact covering up much of the coronavirus and its severity.
China did take drastic measures to try and stem the outbreak, but that's the only story China wants the world to see. And state media is eager to run praise from foreign experts to back up China's successes.
It's a remarkable response that's being organized in China to contain the virus.
One tweet from state media that did reveal Chinese citizens' discontent, it was quickly deleted.
Zhao Lijian set off a storm recently by taking to Twitter to suggest there was something more to the story after the U.S. Centers for Disease Control and Prevention admitted, without giving a time frame, that some influenza deaths in America had turned out to be COVID-19 cases. When did patient zero begin in the U.S.? How many people are infected? What are the names of the hospitals? It might be the U.S. Army who brought the epidemic to Wuhan. Be transparent, make public your data. U.S. owe us an explanation, he tweeted. The inflammatory tweet echoed a Canada-based conspiracy website's unsubstantiated claims that America was the real source of the coronavirus, apparently linking it to the U.S. Army's participation in the Military World Games, which drew competitors from more than 100 countries to Wuhan last October, before the Chinese city became ground zero for the pandemic. On the face of it, China has just accused the U.S. of a jaw-dropping act of war, prompting the State Department to summon Beijing's ambassador to Washington for a dressing down.
After watching one recording of South China Morning Post, it's easy to see that the blame game goes both ways. Trying to find someone to blame does nothing to solve the issue. Instead, it actively drives us apart. Right now, people are struggling to meet some of their most basic needs on a global scale. When we band together as people, we find solutions and we find them faster. This is a global issue, and the nationalist ideology, as well as the incomplete and inaccurate information, will only push us further into isolation and away from each other, more than just physically. Almost everyone can agree that Trump has some of the worst diplomatic public speaking skills that we've perhaps ever seen in a president. However, clips from MSNBC News framed Trump saying, "Governors are responsible for testing," initially makes the viewer feel that this is yet another attempt to shirk his responsibility. The U.S. Constitution was set up in a time of centralized power being unable to understand its citizens. Like when America was a British colony, it literally is the governor's responsibility to make sure that states get testing and test kits. Following the theme of clear communication and working together, a better idea would be to meet with all 50 governors via video chat, of course, to discuss the importance of accurate information, testing, and physical distancing right now. Georgia's Governor Brian Kemp announced in early April that he just learned that asymptomatic people can transmit the virus. Meanwhile, those of us that have been listening to the CDC and frankly science knew that asymptomatic people could spread the virus in February. Even more painful is to see our own Lieutenant Governor of Texas, Stan Patrick, make this announcement.
No one reached out to me and said, as a senior citizen, are you willing to take a chance on your survival in exchange for keeping the America that all America loves for your children and grandchildren? And if that's the exchange, I'm all in.
This attitude will extend this pandemic to longer than it needs to be, effectively causing an even worse economy and more inflation than we've ever seen in our lives. We can see evidence from countries around the world who didn't take social distancing seriously, like Iran, Spain, and Sweden, who are now home to grave sites that can be seen from space.
This week, we saw these satellite images emerge of what appears to be a graveyard in the city of Qom. Now, Qom is where this virus is believed to have first taken hold in Iran and where most of the cases have been reported. Now, these satellite images show this vast graveyard expanding significantly since October. And that, of course, has raised further questions about these numbers being provided by the Iranian authorities. There has been a lot of suspicion that the numbers, both of cases and deaths, could have been a lot higher than the official numbers that we're hearing.
It's crazy that that alone isn't enough for some people, and the economic impact of potentially millions of Americans dying needs to be emphasized. Just the number of people infected with COVID-19 needing hospital care is bad enough for the economy. Healthcare workers knew we would need more personal protective equipment, hospital beds, and ventilators just to stop the spread and give patients the care that they need. The phrase flatten the curve comes from a predictive graph by the Centers for Disease Control and Prevention. The straight horizontal line on the graph is our healthcare system capacity. Flattening the curve, or number of daily coronavirus cases needing hospital care over time, is the difference between doctors having to choose who gets life-saving care and who does not, like in Italy. One thing to keep in mind is that even if you aren't at risk, you could infect others, and it's important for everyone to stay home and practice physical distancing. You might be fine if you get it, but you will spread it to others, like mom and grandma. Don't be selfish, save the hospital bed for someone else. In this time, it's important to remember what matters: connections with others, staying aware of fake or biased media, and staying safe. Call mom, check the sources, stay home, and think about your community. Thanks for watching. I'm Sarah with Surviving the 21st.